In a bid to battle the COVID-19 crisis in the national capital, the centre is now stepping in. Home Minister Amit Shah has called for a second emergency meet that's at 5 p.m. today to discuss the COVID situation. The meeting will be attended by Delhi Chief Minister Arvind Kejriwal, the Union Health Minister Dr. Harshvardhan and also Lieutenant Governor Anil Baijal. According to sources, Kejriwal will be following up on a request for additional beds in central government hospitals. Remember that Delhi has been seeing a spike in COVID cases. Delhi yesterday recorded 7,340 new COVID cases. 96 fresh deaths were reported yesterday, taking the total cases now to 4,82,170. Overall, over 7,500 deaths have been reported in Delhi due to COVID. Chief Minister Kejriwal may also seek the centre's help in ensuring cooperation from other states in controlling pollution levels. This is Amit Shah's second entry into Delhi's COVID fight. In June this year, Shah had stepped in to beef up the healthcare sector and help the capital really flatten the curve. Delhi has been witnessing a surge in COVID cases due to rising pollution levels, due to crowding at markets and people simply ignoring basic norms.
कोरोना बढ़ रहा है, इसको लेके मैं भी चिंतित हूँ। दिल्ली में पिछले कुछ दिनों से कोरोना बढ़ रहा है। जो भी उचित कदम उठाने की ज़रूरत है, हम वो सभी उचित कदम उठा रहे हैं। अगले हफ्ते भी और कई सारी चीज़ें हमने सोची हुई हैं, कई सारे कदम और उठाए जाएंगे। मैं उम्मीद करता हूं कि हफ्ते 10 दिन के अंदर फिर से कोरोना की स्थिति काबू में आ जानी चाहिए, कोरोना कम होना चालू हो जाना चाहिए। अभी कुछ दिन बढ़ रहा है, लेकिन मैं समझता हूं कि हफ्ते 10 दिन के अंदर कोरोना की स्थिति दिल्ली में काबू आ जानी चाहिए।
Let me take this across to Ashutosh Mishra, who's joining us live from Delhi with more details. Ashutosh, that meeting at 5 p.m. will be very closely watched because officially now the centre seems to be stepping in. The Delhi government and centre going to be working together to once again flatten this COVID curve.
So 3 hours from now, this crucial meeting will take place at North Block, what I'm told, or maybe at Home Minister's residence. But clearly on this agenda, remember, the Delhi's Chief Minister had sought a time to meet the Union Home Minister as far as the tackling COVID situation is concerned, and mainly to also have a reserve bed in the central-run hospitals in the national capital. So clearly, we have seen there is already private hospitals where the COVID beds, and including the ICU beds, have been kept reserved. In fact, there was stay from the High Court, and later it was challenged to the double bench. Then High Court gave a go-ahead that for at least for a few days, these beds can be kept reserved. Delhi government-run hospital, there are already ICU and COVID bed either occupied, and also for a portion of that have been kept reserved. But significantly, there are central-run hospitals as well, and that is going to be the agenda from the Delhi CM, that how there is a specific number of beds, including the ICU beds, need to be kept reserved for the COVID situation, as there are deaths being reported every day, 90 to 100. And in last week, more than 500 people have lost their life due to COVID situation. And as you rightly mentioned, that people seems also to be very careless. There is a massive crowding in the market, and obviously because of the festive season, people are violating norms, not wearing masks. So, social distancing has gone for a toss. So clearly all these things, when are unfolding around the COVID situation, were likely to trigger up. And moreover, it has worsened because of the pollution situation. We all need to know that the AQI index is more than 500. So this meeting, there will be certain requests made from the Delhi government to the Union Home Ministry, and also because of Niti Aayog member Dr. V.K. Paul, they all will be present in the meeting. We'll have to also see if there are further any guidelines coming from the MHA.
Ashutosh, my apologies for interrupting. We're going to